Hi guys, I'm Jim. For those of you meeting me for the first time, I am what I like to call the head coach here at IIN. I've had a career in wellness for 20 years, working with companies like WebMD and Everyday Health, and writing my own books and starting my own wellness centers. And now I'm super fortunate to be here with you, what I call my IINers, which is a tongue twister. But more exciting, today we have Dr. Funk, who I'm thrilled to have here. Welcome.
Hi, Jim. I'm so happy to be here.
Yeah, thanks for coming.
Thanks.
Okay, so I'm going to actually read this because your credentials are so impressive and so long that I don't want to get them wrong. You are a board-certified breast cancer surgeon.
I am.
A surgeon.
Yes.
That's always amazing to me. Co-founder of the Pink Lotus Breast Center in Los Angeles.
Mm-hmm.
A regular expert on shows such as The Today Show, The View, Dr. Oz. Dr. Oz is one of our visiting teachers, so we work with him as well. We love him. And local and national television shows. And any of those a favorite? Are you going to play favorites?
I do love local. The doctors, well, they're not local. They're syndicated, but they're local to me because I don't have to get on a plane to like Good Morning America. Yeah. So I think GMA is a favorite. Okay. And The Doctors is another favorite.
All right, we won't tell them you're playing favorites. You're on the advisory board for Breast Cancer Initiative, fourth by the Physicians Committee for Responsible Medicine. And now what we're adding, and I'm super excited to talk about it, is your new book. And tell us about that.
Yes, so the new book is called Breast, the Owner's Manual. And this was really transformative for me personally as the author, which I didn't expect at all. Right. I knew most of what I was planning to write about, and I knew what to write, right?
Okay.
What changed my world dramatically was my deep dive into nutritional science, to write the 2 chapters about what to eat and what not to eat. And I had known my whole career some nutritional pearls of wisdom, which I passed along to patients in a quick fashion, right, as I'm exiting out the door, because you only have 10, 15 minutes with a patient.
If that much, isn't it? I thought I saw a stat that was maybe 8 minutes now.
That sounds accurate. Yeah, I'm including charting time. So literally, you have to do your job, right? So for me, it's to do an excellent breast exam and maybe an ultrasound and to make sure this woman doesn't have cancer or a breast cancer recurrence.
Right.
That's what she's there for. Mm-hmm. And so there's no CPT codes that give me a reimbursement to say, by the way, did you know? And then have this whole explanation about how diet, nutrition, and lifestyle can dramatically impact all of their health outcomes, right?
Yeah.
But there's no time and there's no money. So it's a double whammy of ain't gonna happen, right?
Right.
And that was my main impetus for writing the book in the first place.
Okay.
It was a lot of the advice that I had garnered along the path of a lot of lecturing to community centers when I was first starting my practice. You know, I didn't have any patients, so I'd go out and lecture to like 5 old ladies kind of there for the free pens. Like it was, that's how you start out.
Yeah.
And I would jazz up the talks by throwing out things like, hey, do you know 3 cups of green tea a day cuts breast cancer in half?
People love the tips.
Right? They're very actionable, and you can start today. And so that's how I got my tips along the way. But they were just that. They were tips. They weren't embedded in this bigger structure of understanding from a nutritional perspective, from a biological perspective, what food has the power to do to your health or to your detriment. And so full circle back to writing the book. I do my deep dive into nutritional science. And I don't know if you guys all know, but we MDs get Zippo for nutrition when it comes to medical school and training. Oh, nothing. Not even a passing lecture. You learn the ATP cycle, you know, how energy is made, Krebs cycle. That's it.
You get a lot of information about pharmaceutical drugs.
Mechanism of action.
But not about the actual food that you put in your body.
Nothing.
Interesting.
Not a peep. There are excellent advocacy groups right now trying to change that in medical schools, but that's still not the reality. So even your current graduating class knows diddly squat.
Yeah.
Okay, so here I go into the science, and I'm just going in there to prove that the way I eat's correct, which is largely Mediterranean diet style, lots of lean meats,
my favorite.
Veggies.
Yeah.
But and carbophobe, right? So I'm a product of, I was in high school in the 80s, and you did not touch pasta, bread, potatoes, rice.
I didn't eat potatoes or bread for 15 years.
Okay, so I had this carb phobe, and I just wanted to prove with science that this is the way you should eat. And I came out with my mind blown and my eyes wide open about how toxic animal protein and animal fat is to the insides of you, how the cellular response is all about elevating estrogen levels, growth hormones, the big daddy of them all being IGF-1. Inflammation abounds, free radicals go crazy, DNA damage happens as a response to consuming these foods. On the opposite end of the spectrum, what I didn't realize was the known power of the phytochemicals, the plant-based nutrients in fruits and vegetables, in legumes, in beans, peas, and nuts. I did not realize that there was such a vast array, a true arsenal of weaponry in these vegetables that when I just chew and swallow broccoli flora, and I'm not thinking about sulforaphane.
Right.
But yet there it comes into existence. Wasn't even there before you chewed it, by the way. It was an isothiocyanate before. Now I got all these chemical names in my head. But when you swallow that, sulforaphane gets into your bloodstream, goes coursing through your veins, saturates all of your cells, creates a microenvironment around every cell in you that is either screaming out pro-cancer or anti-cancer.
Right.
And everything changed. For me, my 3 sons and my husband and I, in a day, I'd had enough of reading all of this, walked downstairs, opened up the fridge. My kids were just almost 8, triplets.
Started throwing everything out.
Yeah, I ran. Boys, come here. They ran over to the fridge.
Yeah.
They're like, yeah. I'm like, we're going vegan. And they were like, yeah. What is vegan?
What is vegan?
Yeah.
We don't get to eat meat anymore. I mean, there's all sorts of articles and I guess as breaking news that you can eat as much meat as you want now.
Yes, so that I can happily debunk if you'd like, because...
So these kind of debunking, we'll get to, I want to debunk some stuff.
Okay.
Because there's a lot of confusion. Like the New York Times writes an article, our food is killing us, and then the next day we can eat as much meat as we can, and we shouldn't eat carbs. I literally didn't eat pasta for 15 years. I eat it all the time now. I love it. But it's like, what do you do? And if you're only spending 8 to 12 minutes with your doctor,
right,
who can help you?
Your doctor who had a hamburger and fries for lunch.
Totally. My mother was a registered nurse who carried 2 packs of cigarettes, stood outside the hospital so she could give one away to patients and smoke the other herself. Like, there is a new regime, right, of integrative nutrition that kind of really sets a path, but it's often not the healthcare professionals that are paving that path for patients. Do you find that health coaches are kind of what is making that happen?
Health coaches are critical to making that happen because people aren't going to hear about this from their doctors. So health coaches are definitely going to be the patient's best advocate for their own health and wellness.
Right.
Beyond the physician. I mean, the physician really still, sadly, the vast majority of physicians are there to write prescriptions. It's all about pills and procedures.
Uh-huh.
There's no turning the faucet off where all the running water is happening. We're just about, we got to clean this up over here. Let's keep cleaning it up.
Right.
I don't even see the faucet.
Right.
You see the faucet.
Yeah.
Health coaches see the faucet.
Health coaches see where the water is coming from instead of the spill on the floor.
Right.
And we really need that. We really need guides that can show us with 110 million Americans pre-diabetic, there is a real need and a role for health coaches.
68.8% of Americans are overweight or obese.
Right.
This is not normal, and yet it's the norm. Mm-hmm. It has to change.
So tell me more about your book. Who's this for? Who would be your reader? Who should buy your book?
Every woman.
Okay.
And even children. I'm not 7-year-old, but starting around 13, I think it's critical to understand that the daily choices you are making, and you're setting such deep habit patterns as a teenager. Mm-hmm. What you're eating, what you're thinking, right? Stress levels, the company you keep, and exercise. Mm-hmm. Being obese or not. Later, for the older ladies, whether or not to take hormone replacement therapy. Environmental pollutants and toxicities over which you have much more control than you think.
You do, even from the mattress that you buy.
Right.
Yeah. So are we saying that your book can kind of give the information needed to either predispose or not to breast cancer?
Exactly. It's every woman's guide to maximal risk reduction. So if you've never had cancer, read this book, do everything I say, and then my mission on life will be complete, and you should probably, most likely, never get breast cancer. And if you've had it, it's just packed with wisdom about how to avoid a recurrence. So it really is for every woman, and the focus of it is your breast, but it turns out that everything I say to do also staves off all of your major killers. So heart disease, stroke, diabetes, Alzheimer's, obesity, and every other cancer.
It is integrative nutrition.
Exactly.
Yeah. Two things I want to mention. One is you're wearing red today. The IIN swirl, our logo, is red. And in health, it's like, wow, you're really bold if you're doing red. You know, usually you look at everything from every health site to the doctors, it's blue and green. Mm-hmm. And the interesting thing is that Buddhist monks wear red. And they wear red so you can't differentiate between each other. And because red is the color of your blood. And the way that we started this company and the Institute for Integrative Nutrition was around the food that you put into your body turns into your blood and fuels you and makes you move and makes what happens to you, the outcomes happen. Mm-hmm. So it's really interesting that we don't think more about the food that we put in our body and how to coach around it, because it is what is truly turning into our blood and making us live. Mm-hmm. So that's really interesting. You also talked about your mission. This is your mission. So did you have an aha moment that we talk about at Integrative Nutrition, the aha moment that kind of sets you on the path, your journey?
Right.
Did you have one of those?
I've had two for this journey. So the first, we have to go way back to when I was in undergrad at Stanford. And I was studying for a final, a Neuro Psychology final, which to date was the hardest class I've ever taken in my life. Taught by this wild-haired man.
I'm from Boston, and what we would say about you is that you're wicked smart. Is it Stanford? Fantastic. Okay, keep going.
That class, this guy was so fascinating to just stare at in class. He had this wild, like Einstein hair, and then was missing his middle finger because a monkey named Kiki had bitten it off.
That's something we'll delve into on our next one. I want to hear more about Kiki. Okay.
So I'm studying for this final, and it was not an audible voice, but it overtook my thoughts. And this sentence was, "You're going to be a doctor." Okay, I was majoring in psychology only because I couldn't bear the thought of majoring in drama, which is what I really wanted to do, but that would have been a real waste of money.
Right.
So I did literally 19 shows when I was at Stanford. Like, drama was my thing. I loved it. And I was going to combine my interest in psychology with drama to create a psychodrama program for kids to work through issues, right? Whether it's illness recovery or emotional trauma, et cetera. That was my path, and I was like, oh, a doctor, that's cute. Maybe I'm going to marry a doctor. Like, that's what I was thinking. I had to study, right? No, this thought would not stop. And I didn't heed it at the moment. I was like, okay, I hear this. It's never happened in my life before, a thought, like penetration, right? An epiphany like that. So I finished my finals, and 2 days later, I'm on a plane to Africa, where I spent the summer in Kenya as a short-term missionary and teaching English and religion to the Kipsigis tribe out living in a dung hut. And the missionary that I was living with, the car broke down. She had this Jeep. So she went off to wherever to get help, and I slept in the Jeep. Woken by rocking back and forth, and I think there's some sort of earthquake, but then all these little heads are poking out, and there's about 20 kids around the Jeep. And we can't speak a lick of... We can't communicate except that they have a ball that is like right out of a movie made out of tape, right? And so we start kicking it around and playing soccer, and I'm terrible, so that's awesome because they can totally run circles around me and think it's funny. Then we walk to their house, and I'm sitting on the ground because there's no furniture, and I'm bouncing potatoes on my head to make them laugh because I'm also incapable. I mean, their moms like walk with like 45 potatoes on their heads, and I can't do two. So they're laughing, excuse me, and boom, that was my aha moment. That is what solidified it. And I thought, okay, God, now I hear you. These people are so joyful. They have nothing, and they're so happy.
So much joy.
Because they have health, and they have love, and they have what matters most.
Isn't that the ultimate currency? Oftentimes we get wrapped up We get wrapped up in, I need this and I'll be happy.
Right.
And I need this and I'll be happy. And when I could afford this, or I have to have that, or Instagram, they have it and I don't.
Right.
But the ultimate currency, and something that we teach a lot about at Integrative Nutrition, it sounds like you are a teacher of it too, is happiness and love. And oftentimes we are trying to make money and buy things because we think it will bring either happiness or love.
For sure.
Right.
For sure.
But why don't we just skip that and go to the bottom, the ultimate happiness and love? And oftentimes, you can find that through relationships, or even your relationship to food. Mm-hmm. Some food makes you tired and depressed. Mm-hmm. Some food doesn't.
Food is powerful.
Yeah.
And that is my second epiphany aha that set me on my mission. Was in writing the book, I realized, okay, this is my assignment. All the women of the world, the men can listen and read the book too, but really I'm getting to women through their breasts, because it is the most common cancer to happen to them besides skin cancer.
Yep.
And many women fear it for good reason. And so if I can get their attention that way and then do this stealth move where I just transform all of their health, then my mission will be complete. But this writing of the book changed everything for me. Mm-hmm. I can only get to one woman at a time with my new mission and with my surgical skill, right? And I want to reach everyone I can. Mm-hmm. My little office isn't enough.
Right. And you will. It's a revolution in wellness right now. We need to light up as many people as possible to understand this stuff. Let's do some debunking.
Oh, I love that.
Okay, so let's start with the news. Eat as much red meat as you want.
Okay, so the IARC, the International Agency for Research on Cancer, in July 2015, met in Lyon, France. There were 22 researchers, 10 different countries, 800 epidemiologic studies about answering 2 questions. That was their only job. And I should say this organization is not bought. They don't get money from any, like Big Beef going,
okay.
Let's see what your conclusions are, right?
Yeah.
Okay, so...
They're credible.
Exactly.
Okay.
They had 2 questions. Does red meat cause cancer? Does processed meat cause cancer? Mm-hmm. And they came out with the official, they're the group, the agency that decides what gets on the absolutely carcinogenic to humans list versus probably carcinogenic versus eat as much of that as you want, right? It's not just food. So on their class 1 absolutely carcinogenic to humans list, they put all processed meat. So bacon, sausages, hot dogs, but even the sliced deli meats, right? The organic turkey breast that's sliced up.
Is that what has the nitrates in it?
Yes.
That's the dangerous stuff.
Right. So nitrates, when they combine with meat, become nitrosamine or nitrosamide, and those are powerful carcinogens. Not so in vegetables. So those become nitric oxide in vegetables, which is a blood vessel opener. So it's the opposite effect. It's actually promoting your blood flow and health. Okay, so absolutely carcinogenic to humans is processed meat, and probably carcinogenic is all red meat. We know that these meats, for sure, lead to colorectal cancer and prostate, gastric, and pancreatic cancers. Okay, for sure. And there's strong evidence that they cause breast cancer. So this news comes out that you can eat as much meat as you want. I looked at the exact article. So it's a what we call a meta-analysis. Yep. The authors looked at a number of studies, conveniently left out 3 massive studies that we all look to. The PREDIMED, which you probably know establishes the Mediterranean diet way of eating, substituting these red and processed meats for leaner meats such as fish and more olive oil, etc. The PREDIMED diet, the DASH diet, which has to do with stopping hypertension by not eating meats, and to me, the big daddy of them all, the Lifestyle Heart Trial by Dr. Dean Ornish, that was literally showing that the avoidance of meat will take blocked coronary vessels and open them back up. You can reverse the number 1 killer of you and everybody you love by avoiding meat and eating plants, okay? Those, they weren't part of the meta-analysis, first of all. Second of all, what was in there? Across the board, every single study, between 6 and 14% decrease in the occurrence and the death from cardiovascular disease and cancers and stroke and diabetes.
Right.
They all showed improvement. But the conclusion, and this is the tricky part, the conclusion was 15% or so, that's not that much. And people love meat so much that they probably aren't going to be willing to give it up for that small benefit. So eat as much as you want.
Right.
That was the conclusion. It's such a disservice to humanity to sensationalize that erroneous conclusion and then make it even greater by saying, meat's back on the table.
Let me ask you this, just to wrap this debunking up. Does this mean we can't eat grass-fed, organic, lean beef, or is that the only thing we should eat?
So there are 3 things about meat that you should think about when you choose to eat it. So number 1 is what it's doing inside of you when you chew and swallow it, and it does not matter if it's organic and grass-fed and that cow had 500 acres to itself, right? Because it's a cellular response to the animal protein. The second thing to think about is what is actually in the meat. So all of the feed additives and the GMO, this and that, and the pesticides, et cetera, is clearly harmful. So yes, eating that, an organic grass-fed beef burger, would be a much healthier choice than a conventionally raised cattle burger.
Right.
And then the third thing to think about is what's missing from this meat. There's only so many calories you're going to put in your body every day. And what's missing is fiber, which is really critical. So no meat has any fiber, not a shred. And except for organ liver, you're not going to get any of the fat-soluble vitamins, so ADEK, and there's no vitamin C. So you're missing some critical vitamins, and you're missing fiber.
Right.
So the question someone needs to ask when they ask me is this okay to eat, or is this healthy? Is fish healthy? The question they need to ask themselves is compared to what? Compared to what? Because a big leafy green salad with a bunch of lentils and some avocado and some tomatoes, et cetera, is going to trump the organic grass-fed burger. Okay.
So sometimes you just want to eat for taste. And if you're going to make that choice, make good choices, basically.
Hear, hear.
Yeah. Okay, what's something else we can debunk?
Oh, this is probably, it's my favorite. My favorite debunking is, you ready? I'm going to throw it at you.
Okay.
Let's see. What percentage of breast cancer is from an inherited genetic mutation, like BRCA?
Okay. 5%.
Ding, ding, ding.
Did I get it right?
You did get it right.
All right. That was a guess.
That was a good guess. And most people would almost go to the extreme opposite number and say something like 80, 90, 99%. They think it's in the genes.
So much more. It's in your genes. Okay.
Right. So only 5 to 10% of all breast cancer comes from an inherited mutation like BRCA, which, yes, it predisposes you phenomenally to get breast cancer. It's still not entirely unavoidable.
The rest is external, what goes into your body?
The rest of it is every choice you're making all day long. So it's what your diet and nutrition, alcohol, exercise, obesity, hormone replacement therapy, emotional stress.
What about the deodorant you put on?
Whatever you want to do in terms of deodorant is fine by me, as long as you don't smell around me. So I did a deep dive into deodorant and aluminums, and I understand. There's no more parabens really in deodorant. You'd be hard pressed to find it in deodorant. They remove those. But you still have the aluminum sulfates, and there are a couple of excellent theories, but they're theories and they have no grounding in science, as it turns out. So I went down that whole path when I wrote the book, and there's a whole chapter 2 is debunking breast cancer myths, and deodorant and bras and cell phones and microwaves, it's all in there. Okay. So these EMFs, for example, are non-ionizing in your cell phone and the microwave, and they just don't carry the power to create DNA damage. So you can tuck your phone in your bra if you want to.
Okay. You can keep doing that. Keep doing that. But specifically, is the biggest catalyst of this, it must be the food. I mean, people are getting really interested in, okay, we're sleeping for most of our lives, not metaphorically, literally. We go to bed and we sleep for 8 hours a night. Hopefully we should.
Right.
The mattress and the pillows on which we're sleeping and breathing have contained toxins forever that could potentially be making us sick. Do we need to worry about that stuff?
Not to the point that it paralyzes you.
Right.
What you do need to worry about are boulders. So I believe things like maybe the aluminum in your deodorant or the toxins that are in our mattresses and the formaldehyde. It is ubiquitous, but your mattress is controllable. That's your choice what to buy, right? So you can control that. The boulders, though, on this scale of life that tip you toward or away from health, the boulders are going to be, when it comes to breast cancer, nutrition. So what are you eating? And I want you to eat a largely plant-based diet, exercise, limiting or eliminating alcohol, and weight. You can't be overweight or obese.
Right.
So maintaining an ideal body. Those are boulders that are really going to affect change. And now everything else is a pebble. And sure, that can tip the scales one way or the other.
Right.
But environmental toxicities and things like emotional stress, which I think is incredibly important. But if you have a boulder on your scale, it's just so heavy.
Right.
You can be really happy and really overweight.
Yeah.
And that weight is just going to bring your health down, no matter how happy you are.
Yeah. That's interesting. So, but what starts to get confusing, and why I'm bringing these things up, it's every day there's a new pebble, right? Every day there's a new pebble that we question. Should we eat meat? Should we not eat meat? Is it grass-fed? Is it lean? Is it not? Should I eat lentils today? Do I need to change my mattress? Is my shampoo killing me? Type of stuff.
Right.
And this is really why we need a health coach.
Oh, for sure.
Right. This is why we need to become health coaches. We need to learn this information so it's not overwhelming. It's like a tidal wave. It just crashes down on you. But when you learn what those boulders are and how you can affect change to those boulders, the other stuff is kind of intuitive pebble stuff. It goes along with it. We need to learn to become health coaches and then spread that word like a wellness revolution by lighting up everyone else when we do become the coach, to become coaches themselves.
Right.
Would you agree with that?
I do agree with that. Your goal should be to become your own health coach, but you need a health coach to teach you what you're
right.
what you're coaching.
First get taught, then go teach.
Right. So I love what health coaches offer to come alongside a person probably woken up in a moment of, whoa, this life is not infinite, and I just got a diagnosis of whatever, right? Diabetes or cancer, et cetera. Or autoimmune diseases are, I think, largely dietary and environmental. So there's a lot of autoimmune disease out there that is incapacitating for people. They're not living their best lives. And a health coach can come in and start to recognize the habit patterns and the fairly easy to change dietary and lifestyle and behavioral patterns of these individuals to affect an incredible 180.
Right.
So
and the world needs it. It's a career that's growing. By the way, health coaching is a career that's growing faster, according to the labor statistics, than any other career. There's one other career, and it's hairdressing. That's growing very fast. I don't know why, but
fascinating.
Just so you know.
Okay.
Just a little fact there for you.
I love that.
So health coaching and hairdressing, it's one or the other.
Okay.
People need both. But health coaching is growing so quickly because so many people need it, and there's so much more information. When people, like you said, begin to wake up, they now need information and guidance, and that's why the profession is growing so quickly. And I think it's so important as well. But Dr. Funk, thank you so much for coming.
Jim, thank you for having me.
It's been such a fun conversation. We could do this for hours. But before we go, I want you to tell us a little bit, if you would, about your summit.
Oh, yes. The Cancer Kicking 2020 Summit is coming to an oceanfront resort that will take your breath away and set the stage for what we're going to do. So this is a high energy, super intense, but not overwhelming, deep dive into the soil of your life, where I'm going to get in there and we're going to get dirty and we're going to unshackle mental chains, and I'm going to provide women with these really actionable, take it home, start right now, power types of changes to diet and exercise and their way of moving throughout their lives and their days. And they're going to leave empowered by new friendships that they never expected to make.
That sounds amazing.
It's also online, so you can do on demand.
Great.
Yes. That will be available for those who don't want to trek to beautiful Southern California. But Terranea is an amazing seaside resort that will really be an important part of it. But if you're doing the on-demand, we'll make sure you see what you're missing.
All right.
It's going to be really transformative, and I've worked really hard on the curriculum and to make it engaging and fun and actionable so that you're not driving back to your house or the airport with the mountaintop experience.
Yep.
Just taken away by the traffic. That's not going to happen.
Right. Good. I want to end on one thing that Dr. Funk said, and it's specifically, life is not infinite. It matters what we do now. So do it. It's your time, and we need to make a change. People need your help, and most importantly, help yourself. Thank you very much.
Thanks, Jim.
Hello there, and thank you so much for watching. My name is John, and I work on the student success team here at the school. As a health coach myself who went through this program, it's so cool that my whole job is to support students from the beginning to the end while they go through this program. If you're interested in learning more about health coaching, it's such an awesome profession. I'd recommend heading over to our website where you can get a lot more information there. And hopefully one day I'll be supporting you.